How does the spine cope with flexion, extension and rotation? We bend and stretch without any regard for what we are doing, as it seems to be a very simple task. If we understand what the spine is doing, then we can be better advised on how to do the task. The spine moves to match your direction. For example, flexion, extension and rotation. Injuries can be defined in two separate ways. Firstly, an acute injury, which is defined as a discrete event, or an overuse injury where wear and tear occurs due to suboptimal movement patterns. This is the spinal column. These are the vertebrae, and the jelly-like material in between is known as the discs. The discs can perform many different functions, and they compress and extend depending on which way you decide to move. For example, compression in forward flexion and compression in extension. It's also worth noting here that the spine also rotates. Injuries occur during compression, extension and rotation with or without load. For example, if you flex the spine forward and add some rotation in, what happens to those discs is that they start to bulge out, and this is known as a bulging disc. This can happen as an acute event, or it can happen performing the movement repetitively over time. So therefore, it's really important to consider our spinal position when we do any lifting, carrying, or other associated tasks in the workplace.